Senior Clinical Research Associate at the University of Cambridge. Raghib, thank you so much for your time. How concerned are you about New Year's Eve celebrations?
Good evening. I think as we heard in the report, what we're trying to avoid both over New Year's, but also in general, is the potential for what we call super spreader events. So particularly we have a lot of people indoors together in areas, particularly if they're poorly ventilated, that's where you have the risk of very high transmission between individuals. And so New Year's Eve obviously is an occasion where that might happen. Depending which country you're in, it may be that you're able to have these celebrations outdoors, and the risk outdoors is much lower than indoors. So if that's possible, that would be encouraged. And in those countries where, for example, lateral flow tests are available, it's good to take one of those lateral flow tests before you attend one of these large gatherings to prevent, again, spreading the infection. And finally, wherever you are, there are basic public health hygiene measures you can take, of course, wearing a mask, washing hands, maintaining good ventilation, and distancing if possible. So these are all things that we can do to reduce the risk in the coming days and weeks.
There are lots of countries that are currently on a festive break. What do you think is going to happen when schools reopen in the new year?
So again, it does vary from country to country. Different countries have had different policies in relation to vaccination of school-aged children. In the UK, we've vaccinated children above the age of 12, but not primary school children. In some countries in Europe, they've done primary school children as well as in the US. So what will happen does depend a bit on how much immunity there is already there amongst children. In other countries, many children have already been infected, including the UK, with natural infections. They have a degree of immunity. So it will vary from place to place, but it's likely that there will be increases in infections once schools go back. That's what we've seen over the last few months with Delta and more recently with Omicron as well.
Do you think the calculation that most people are making, look, most of us are not scientists, so the calculation that seems to be made is, I'm either going to die or I'm going to quickly recover from this thing. And because Omicron does seem to provide a more mild illness, people don't appear to be as concerned as they were in the earlier days of the pandemic. That's also human nature, isn't it? You learn to live with whatever situation you're presented with. But is that a false calculation because of COVID being a disease that attacks multiple organs? There's some sort of evidence, and it's early evidence, I believe, that the virus can live in your body even after you're supposedly recovered.
So on your first point, it's an important point, is that we aren't back to where we were in March or February 2020, because the vast majority of people, at least outside of, in most countries, most high-risk people have been vaccinated, and you reduce your risk of ending up in hospital or dying. Obviously, the worst-case scenario is much lower than it was in March 2020 when we didn't have vaccines, or even this time last year when most people hadn't had the vaccines. So at the individual level, the risk is much lower. What we're really concerned about in most countries is if a lot of people get infected at the same time, then that puts pressure on healthcare systems, and that's what we're trying to avoid. But at the individual level, just to repeat, your risk is much, much lower than it was this time last year. The second question, to be honest, I've seen that research as well. It's not clear, based on that research, whether that's true, that the virus continues to live. I don't think there's good evidence for that. What there is better evidence for is that people continue to have symptoms, what's described as long COVID, long after the infection has been cleared. And particularly if you end up in hospital or intensive care, you're much more likely to experience those long-term symptoms. And so we are, of course, keen, and vaccines are the primary defense against ending up in hospital, but all the other public health measures that I mentioned will also help to reduce your risk of getting infected in the first place.
Okay, I kind of want to ask you a question about healthcare systems around the world, and if you have knowledge of what's happening in the rest of the world, sure, give it to us. But if you want to concentrate on the UK in particular, the WHO has been warning that healthcare systems may come very close to collapse, if not collapse, because of the huge amount of people who will have Omicron, and even if it's a small percentage of those infections that need hospitalization, that could lead to the collapse. What do you know about that?
So that is the concern. As you say, even if it'll be a smaller percentage than it was with Delta, but if a larger number of people are infected, then that could still lead to significant pressure. It does vary again from country to country. In the UK, there's still a degree of uncertainty, but most of the expectation is that it won't be as bad as last winter in the UK. But in other countries, that will be different, partly because they have lower rates of vaccination, or because they've had lower rates of natural infection and population immunity. And in many countries, the healthcare systems are not able to cope with large increases in hospital admissions. So I think every country will obviously need to look at both their levels of population immunity and the capacity of their healthcare systems. And the other problem we're facing in many countries is sickness of healthcare workers. So they also catch COVID and they're off work for a week or sometimes longer. And that, of course, puts pressure on hospitals in particular, but all parts of their healthcare system. So it is important, particularly in those countries with the low vaccination rates or low healthcare capacity, that people are even more careful about reducing contacts and taking all of the public health messages seriously in the coming weeks.
Raghib, thank you so much indeed for your time. Really appreciate it. Raghib Ali, and of course, have a safe New Year's Eve celebration.